Hi, my name's Destiny. Today we're going to be doing a musculoskeletal and abdominal assessment. Okay, can you tell me your first and last name and date of birth?
Donnell Warnock, 10/2/79.
Good. And do you know where you are right now?
Home,
Good. And do you know what year it is?
2023.
Good. And do you know why you're here? Why I asked you to do this?
Getting a physical assessment.
Good. Okay. First, we're going to start with the abdomen. Just get down because we don't have a good touch. Okay, so with inspection, we're always going to start with inspection. So we're just looking, you start at the foot of the bed, if we had a hospital bed, and then you look at the side, looking for any masses that you can see before even touching anything. So next we're going to be doing osculation. So I'm just going to be listening to all four quadrants first with the diaphragm of my stethoscope. And you listen to the abdomen for a minute each quadrant. If you do not hear bowel sounds or you think they're hypoactive, you have to listen for 3 to 5 minutes before you qualify at that. Next, I'm going to be using the bell of my stethoscope, and we're going to be listening to the vascular parts of your abdomen. So your aorta, we're going to do the renal, the iliac, and then we would do the femoral, but we're just going to say the femoral. So we're going to listen to the aorta with the bell first. Good. And then we're going to do the renal on both sides. And then we would do the iliac and then the femoral if we were doing the femoral. Next, I'm going to be percussing the abdomen, and I'm going to use the shape in the book that goes this way instead of around like this. So using my finger, we're going to start over here. And you want to hear tympani, and then over the organs, you're going to hear a dull sound when the organs are heard. You just go down the abdomen, down the quadrants, doing a tap. Next, I'm going to do palpation. So light palpation first, and that's just to assess for tenderness. Then you do deep palpation. Light palpation, 1/2 inch. Deep palpation, you would do 1.5 inches to 2 inches. So you would light palpate the bladder as well. You'd ask the patient, have you emptied your bladder recently? Okay. And you wouldn't feel the bladder unless it was distended, so you just lightly palpate the bladder. Light palpation with your fingertips, and then I'm going to lightly palpate over the abdomen. And this is just for tenderness, so you don't have any pain when I touch anywhere.
No.
And then I'm going to start with deep palpation, always in the patient's right lower quadrant. So you're going deeper, and this you're feeling for masses and for organs if the organs are distended. And you shouldn't feel any of the organs unless they are enlarged, which none of them are. Okay, and then next we're going to move on to the musculoskeletal part. So I'll get you to stand up. Okay, and then we'll push it back a little bit. Okay, so you can stand in front of me. So first we're going to start off with inspection. Again, I'm just looking at the posture before I touch anything. I'm inspecting the shoulders, making sure everything is symmetrical. There's no abnormalities that I can see before. And then while I'm inspecting, I can go ahead and feel for the pulses. So we'll do the brachial pulse, we'll do the radial pulse, and we'll do the ulnar pulse. And we'll do that on both sides. We'll do the brachial pulse, always on the thumb side, radial pulse on the thumb side, ulnar pulse on the pinky side. And then while I'm doing this as well, we'll go back to the same hand. We'll do the cap refill and the skin turgor. So we'll do cap refill. Good, less than 3 seconds. Good. And then we'll do over here, cap refill and skin turgor. Good. And then I'm gonna take my sharp and dull side. I'm gonna get you to close your eyes and hold both your arms out. And then you tell me if you feel it sharp or dull.
Sharp, dull,
Good.
sharp, dull.
Good. Okay, next we're gonna move on to the palpation part. So you're just palpating the shoulders, doing it bilaterally. Doing the shoulders, palpating the joints of the elbows, the wrist, and all the fingers. Then I'm gonna do the same thing on this side. The joint, elbows, wrists. And then next I'm gonna assess the cranial nerve 11. So we're gonna be doing your spinal accessory nerve. So just tilt your head back and then forward. Then we're gonna do side to side, and then just rotate your neck. Good. Okay, and then when I already have you standing up, I'm gonna have you come a little bit forward this way, and then I'll get you to walk away from me. So turn that way and do a walk, and then you'll walk back to me. Just assessing your gait, posture while you're doing that. Good. And then you step back a little bit, and we'll do the range of motion of your arms. And we're gonna do them one at a time. So just lift this arm, whatever arm that I do this way. Good. And then you're gonna do it against resistance. So try to pull up. Good. Then we're gonna do this arm. So lift this arm up. Good. Looking at the shoulders, and then try to push it forward. Good. And then we're gonna be doing it backwards. So I want you to do this arm back like this. Good. And then again, try to do it with resistance. Good. And then do this arm, same way, go back. Good. And then we're gonna try to do it with resistance. Good. Okay. So then we're gonna go to the side. So we'll do this arm to the side. Good. And try to do it against resistance, push it that way. And then do to the side on this arm. Good. Against resistance. Good. And then you're gonna come across with this arm. Good. And then I'm gonna do it where I hold this arm, so try to come across. And then the same thing over this way. And then I'm gonna hold it and try to come across your body. Good. Okay. Next, we're gonna be doing your elbows. So that was the shoulder part of it. Next, with the elbows, I'm gonna get you to do it with this arm. So you're just gonna hold your elbow out like this and bend your elbow back. Good, and come back out. And then you're gonna do that against resistance. So try to come up this way. Good. Try to come up this way. Good. All right. And then after we do this way and this way, then we're gonna get you to come do the across this way. So do it this way, yeah. And then do it this way on this arm. And then I'm gonna do it against resistance. So hold your arm out like this and then try to come inward with it. Good. Inward with it again. Good. Okay, now I'm gonna get you to hold your hands out like this. And I'm gonna hold this hand. And I want you to try to turn your hand in. Good. And then do it this way. You try to turn your hand in. Good. And then hold them down. And then try to turn them up. Good. Try to turn it up. Good. Okay. And then I'm going to get you to hold out your hands like this. Okay. And then I want you to try to bend them forward. Good. And then try to do it against resistance. And then bend them backwards. Good. And then I'm going to hold one of them and I want you to try to do back. There you go. And then I'm going to do it back again. There you go. Okay, now we're going to try doing to the sides. So we'll do one at a time with this one. Try to turn it this way. And then do this one this way. And then try to turn it the opposite way. There you go. And then turn the opposite. Okay, and then you can do that same thing, but try to do it against resistance. This way. And this way. And then this way. Good. Okay, then I'm going to do one hand at a time. So on the wrist, we're going to do the medial nerve. I'm going to tap and tell me if you feel any pain. No pain? Okay, and then on this one, this is the tenal sign. Medial, no pain. Good. Okay, and then we're going to move on to the fingers. So with the fingers, just hold your hands like normal. Squeeze your hands like this. Good, now I'm going to do it with my fingers. So squeeze my fingers. Good, and then hold your hands like this. And you're going to spread your fingers out. And then I'm going to do it against the resistance. Spread your fingers out. Good. Okay, now we're going to move on to the lower ones. So just inspecting again, we did the gait already, but making sure that everything's symmetrical and there's no abnormalities. So when I'm inspecting, I will look for the consistency of the distribution of the hair and the texture of the skin, and then you can also feel for temperature. But I'm going to get you to sit for this part. So this is pulses. Again, I'm going to be palpating the pulses and your capillary fill in your feet. So I would, if in this situation you were wearing a gown, but you would do the femoral pulse and then straighten your leg out. You're going to do the popliteal pulse, and I wouldn't be palpating with clothes on, but it's fine. And then I'm going to do your tibial pulse and then your pedal pulse. And then I do the same thing on this side. Would be femoral, but popliteal pulse, tibial pulse, and then the pedal pulse. And then I'm gonna do your cap refills for your feet. And cap refills for your feet. Good. And then you can stand up. And we're gonna do the lower, so you can stand in front of me this time too. Okay, so starting with palpation, I'm just palpating your hips, making sure there's nothing dislocated. Then we're gonna do the knees, the ankles, and the feet, the joints of the feet. Good. Okay, so now we're gonna do the range of motion of the lower extremities. So just whatever leg I hold up. So hold the leg out, just kick it out. There you go. And then we're gonna do it against resistance. So try to kick your leg out. Good, and then this leg, kick it out, and then against resistance. Okay, and the same thing on this leg, but you're gonna go backwards with your leg. Good. And I'm gonna do against resistance, try kicking it back. Good. And then the same way this way, kick that one back. And then we're gonna do it against resistance. Okay, and then we're going to the side. So leg out this way, and then you're gonna do it against resistance. So try to kick that leg out. Good. And then this leg, and we're gonna do it against this one. So push the leg out. Good. Okay, and then we're gonna go to the inward. So we're abducting this time. That was abducting, so just come across your body. Good. And then you're gonna try to do that with resistance. Good. And same thing on this leg, abducting, and then against resistance. Good. Okay. And that was for the hips. So next we're gonna move on to the knees. So with the knees, you're gonna do this leg up first and just bend your knee and put it back down. Good. So I'm gonna get you to do that motion and kick your leg back with resistance. Good. And then do it on this leg, back, and then try to kick it back. Good. Okay. And then next we're gonna move on to the ankles. So with the ankles, we already did palpating and everything, so I'm gonna get you to sit for the ankles. Okay. So it might be easier laying down for the feet. Just lay down backwards. Okay. So put them up here. Okay. So we're gonna move on to the ankles. So I'm gonna get you to flex your foot up and against resistance. Good. And then flex this foot and then against resistance. Good. And then push your foot down. Good. And then do it against resistance. Down on this foot and then against resistance. Okay. And then I'm gonna get you to turn your foot inward. So try to turn that foot inward and then do it with resistance. And then turn this one inward against resistance. Good. All right. Now we're going to move on. I'm going to get you to stand up again. Good. Okay. So for this one, I'm going to look at your spine. So I'm just going to come behind you. I'm going to raise up and I'm just looking at the curvature without anything, just feeling down all the way from the top to the bottom. Seeing if there can feel any curvature in the spine. Okay. And then I'm going to have you bend at the waist, and I'm going to do the same thing, palpate down your spine for any curvatures. Good. All right, and that completes the musculoskeletal portion. So that's it.